I'm joined today by Debbie Lynn Toomey from the Tufts Medical Center, who will be talking about two programs that she'll be presenting with us here in November. They are all about falls prevention and stress management for aging adults, and they're happening on Tuesday mornings, November 3rd and 17th, both starting at 10 a.m. They'll be live on Zoom and also available to watch on our YouTube and Facebook channels. Debbie, thank you so much for doing these programs with us and helping us just promote good health here in the city of Quincy. I'm so delighted that we were able to continue. We did 4 already this fall, starting in September on the first day of fall for falls prevention. And now we have 2 more happening this month, and we're going to have 2 more in December. So I'm really excited. How's it been going for you?
Oh, it's been going really well. I really do appreciate being able to do this type of outreach. For those of you who don't know me, I'm Debbie Lynn Toomey from Tufts Medical Center, and I work in the trauma department, and my role is injury prevention. So my role is preventing people from ending up in emergency room. So hopefully I do that really well, that we don't get too many people going into the emergency room, but you know, life happens and people need to go. And I just wanted to let you know that Tufts Medical Center is in Boston. Anyways,
A short train ride away. It's certainly easy to get there.
It sure is.
As you know, you live here in Quincy, so you're doing the commute every day.
I do. My role is really to educate the population about ways to remain healthy and happy and safe. And I've been very lucky to be able to have done the 4 sessions on falls prevention and stress management back in the end of September and also October. And
folks who'd like to, they can actually go out and watch those. We have those on our YouTube channel, and I think QATV is airing them as well. So they'll be coming around in the cycle, so they can check the schedule and see those. So people can learn, how they can help, if they themselves are of an age where they need to are worrying more about falls prevention, or if they know people. So these are certainly good for a lot of adults to watch, because a lot of us, if we're not there yet, we know people who are in that stage of life, and we can all learn something and stay healthy and happy. I like that perspective on it too. I know you have a lot of fun in these classes. People get up. I've seen people are getting around, they're moving, and it's not just a passive. I mean, you can just sit and watch it, but you encourage people to engage, and that's how we take care of ourselves.
Yeah. I try to keep the 1 hour together, educational and also engaging. So half the time I'm just talking about information, and the information that I get are very reputable sources like CDC, NIH. There's so many different information to pull out there, and it's always good to hear real news, good news, and important information. And then the other half, I like to keep it really engaging and activity based, so that way people who listen to the show and watch it, they come away with some skills and tools already that they can start implementing that day. So that to me, for somebody who's been doing this type of program for a while, I just find that, a mix of both is so important. And it keeps me awake too. So moving forward, I'll be going over more information because there's so much to share. And I'm working on a lineup of different speakers, different specialists to be able to interview and to have them share some of their information so that all of us can learn something from them. So I'm looking forward to that in November and also December.
So people should stay tuned. We'll certainly let them know as soon as you confirm those speakers. I find that a lot of times when I hear, tips about being healthy, it's things that I've heard before, but it can be a really nice reminder and really helpful for me. Because some of it seems like, oh yeah, that's common sense. I shouldn't, fill up my plate 3 times if I was hungry at the beginning. I need to stop after, maybe a plate and a half of food. Simple stuff. But it's still sometimes important I know for myself to have that reminder, because it just kind of reminds me when I'm sitting down to eat. A reminder about how I can be more physically active, or different things I can simply do. Is there anything really short that you'd like to encourage me? Is there any exercise that you find yourself returning to time and again that we can even take a moment right now to share with people?
Oh, that's a good question. I'm on week 6 of 8. I've been doing this program for mindfulness program for an organization in Boston, the Boston
Mhm.
Senior Home Care. So a mindfulness tool that I like to begin the programs with and also remind people how to do is breathing, mindful breathing.
We're doing it all the time,
We
but
are,
it's not like
yeah.
we forgot how to breathe. But there's a different. I assume this is a way to breathe. You're not telling. I've been breathing this whole time. I
Me
promise.
too. Me too. Me too. I
Good.
just want to let you know that. But it's really, this one is a very subtle yet very important skill to learn, is knowing, watching and being in tune to your breath. So being aware when you are with somebody, when they make you breathe fast and shallow,
Mhm.
and like in a nervous or kind of like an anxious type way. Also being aware when you're with somebody, or it doesn't have to be a person, it could be in a place, when you are breathing deeply and calmly.
Mhm.
So being in tune to that is very important, because sometimes we are so busy, we have so many things going on in our mind, we don't even know that we're being triggered by a situation, a person, or even like an environment. Being in tune to how our breathing changes is so important. Also, when something causes us to hold our breath, just like and shock, because that's also important though. So, there's a lot of nuances that our body goes through and tries to tell us that we are just not in tune to. So today, when I was talking in my earlier workshop, my theme was, body language, body talk. What is your body saying to you? Has your body been saying that the left shoulder has been hurting you and you've been neglecting it? Has your body been saying that your eyes are red and strained because you've been on the computer too long?
I
And
can
if
remember
you,
the first time I was told, I was in an eye doctor, and I said, this happens to me still, I think, where I'll do a lot of reading early in the morning, and then my eyes are tired and things are blurry. And the advice from the eye doctor was like, you need to blink. You need to like put some moisture on your eyes. And I was like, okay, I feel like an idiot, but
it's,
blinking is important.
just like breathing is important, right?
Just like
Yeah. So,
breathing. That's right.
yeah. So
Yeah.
it's just these little things that in what our body does and how it reacts to different energy, different situations, is just so important to be in. We have to be in tune to our body, because if we are not, then our body will create ways for us to listen to it, whether we like it or not. Okay, so whether,
Good way
if
to
it's
put it.
like, yes, because, like a shoulder ache, tension, if you keep neglecting it, eventually we're going to walk around like this, right? After like a few weeks. And then we can't help but then take some medication or see a specialist, or, so if we start listening to what our body's saying to us, the more we're able to start doing something to take care of it. And that's self-care.
That
It's
makes
a
a lot of sense.
self-care. Yeah.
Well, Debbie, thank you so much. These are great programs. I'm really glad to be able to offer them. I encourage people to tune in live and to go back and see the recordings. These are clearly, something where there's a value in engaging, and they can ask questions when they do join it live.
Yeah.
But there's a great value in taking these tips and just reminding ourselves and being kind to ourselves, so we can take that time to listen. I really like what you're sharing today. Thank you.
Yeah. Thank you. Thank you again for allowing me to be able to continue this work. I really appreciate it.
No, it's a mutual pleasure. It's great. Thank you. I hope you've enjoyed my conversation just now with Debbie Lynn Toomey. She will be presenting 2 programs with the library this November. They're happening on Tuesday mornings, November 3rd and 17th, both starting at 10 o'clock in the morning. The titles for these programs are Falls Prevention and Stress Management for the Aging Adult.